Hello, good afternoon. My name is Jamie Bossuat, and I am an employment and business lawyer at Kroloff. My practice involves assisting employers with a full range of employment issues, from preparing handbooks and conducting trainings to helping with litigation and trying cases. And what we're going to be discussing today is a COVID-19 update. For those of you who have been watching these, things continue to evolve. We will have a Q&A box open today, so you can go ahead and submit questions in that. I prefer that to the chat, but if you can figure out the chat, that's fine too. There will be time, hopefully, at the end to answer questions as well. And if you would like a copy of the slides, I ask that you please send me an email. If you put it in the chat, it disappears when the webinar closes, and so then I don't have your request anymore. So we're going to go over general information today about the current status of COVID-19 regulations. We don't have the capacity in this presentation and in this format to give you specific legal advice. So this is all just for informational purposes. So considerations for businesses. What we're going to cover today is the status of reopening in California, workplace safety rules that apply currently, vaccines, and then the current status of leaves of absences for COVID-19. So jumping right into the status of reopening. This is a lot of material to cover today, so please bear with me. I'm going to move through it rather quickly, hopefully to allow some time for questions. So this is a page we are all familiar with, I think, at this point. This was the blueprint for a safer economy. You can see most of the state is now orange or yellow, and so the state is moving on June 15th to eliminate this blueprint that they've been using. So we used to go county by county. They have these different 4 tiers that you could determine which tier you fell into, and then the rules would vary for each workplace based upon those tiers. That is about to be disbanded on June 15th. So if all goes according to the current plan, California is expected to fully reopen, as they say, and a lot of capacity and activity restrictions will be listed. So that tier system that we were seeing on the last slide is no longer going to be in effect. This will allow most sectors to resume operations in compliance with COVID-19 emergency temporary standards, public health guidance, and other guidelines and standards. So that doesn't mean actually that we return to normal and everything reopens as it would have in 2019. Also, there are some remaining limitations on large scale events. So we're going to go through all of that. And when they say the business tiers chart will end, what they are talking about is this chart. So this is continuously updated, and it is available on the website that you see below, the California Department of Public Health website. And this goes through each of the different types of sectors and businesses and gives limitations. So that's being thrown out. And at this point, those businesses can return to usual operations except for mega events. And this is the memo up on the California Department of Public Health website. And that's the link right there on this next page. Below that initial introduction, you see this chart. And this applies to mega events. And a mega event is a large crowd greater than 5,000 indoors or 10,000 outdoors. This doesn't apply to most small businesses. And so those limitations are for those very large crowds. This is what we are dispensing with on June 15th, if everything goes according to plan. But even beyond the blueprint, schools and institutions are going to conduct full-time in-person instructions. Currently, from what I've seen, the mask mandate for schools will remain in place. I think in part due to the fact that most children still can't be vaccinated. Workplaces must still promote policies that reduce risk, including improved indoor ventilation and mask wearing in high-risk settings. and remote work when possible. So they say, oh, everything is reopening, but there's still these caveats that apply. And then there's restrictions on travelers based on the CDC and CDPH's California Department of Public Health recommendations. So I think that's going to continue to be adjusted based on outbreaks around the world and in other parts of the country. So one of the big questions I get all the time is face coverings. Do we still have to wear masks? So this is the current guidance, which was issued, I believe, on March 3rd in California. And so the note on there, I pulled this down off of the website, but the note there indicates that it has to, this applies until June 15th. So everyone currently must wear a mask indoors in public places unless they're eating or drinking, while on public transportation, and in both indoor and outdoor crowded places like a sporting event. You can go unmasked outdoors if you can maintain physical distancing. Indoors, if you're fully vaccinated, you can go unmasked if everyone else is vaccinated, or if those who are unvaccinated are members of a single household and at a low risk. So this is the current recommendation. So we have this in place now for another few weeks. And here's a brief summary. Indoors, everyone must wear a mask still in California. Outdoors, fully vaccinated persons are not required to wear a mask. Unvaccinated people have to wear masks outdoors when they can't maintain physical distancing. On June 15th, the state is anticipated to bring its mask guidelines into compliance with the CDC recommendations. So what this will mean likely is that vaccinated individuals won't need to wear masks indoors in non-crowded settings. I think for mega events, we're going to see what they end up doing, or for very crowded indoor events, there might be some limitations there. The state has not issued its mask guidance that it intends to put out on June 15th. So we're still waiting for that. Then for businesses and employers, the big question is Cal OSHA going to adopt this guideline? And we will wait and see. The guidelines were issued a few weeks ago, going through the rulemaking process. They were supposed to be approved last week, and Cal OSHA pulled them and said it's reissuing new guidance in line with this reopening plan. So I think, if I had to take a wild guess, unvaccinated individuals may no longer have to wear masks in business settings. But we are going to have to wait and see on that. And then also private businesses do have the option to require masks if they want to. We saw this early in the pandemic before there was a statewide mask mandate. Some businesses required masks to enter their building. Costco, Trader Joe's, some of the examples. And some offices, medical offices, still do have special exemptions that may require ongoing masking. If you go into your doctor's office or to urgent care, there are exemptions that require continued masking because those are particularly high risk environments. But private businesses can make the decision to require masks even when the state does not. Now, what I've read in the news is that many are not. I think Costco, I read in a news article, for example, was not going to require masks as of June 15th. We'll see. They also run vaccination centers, so let's see what happens there. So these state regulations are enforced through alcohol and beverage control, which is regulating restaurants and bars, and then the Department of Industrial Relations through the Labor Commissioner's Office and Cal OSHA. So really, as business owners, our greatest area of liability is with Cal OSHA at this point in time. And we'll go more into what they're looking for and what the rules are in a moment. So actually, here it is, workplace safety. This is moving into the Cal OSHA requirements, what's required now, what might be required in the future. Let me just check my Q&A box here to see if there's any questions on the last segment we went through. Oh, questions about vaccines. We're going to get to that. Don't worry. Okay, so moving on to workplace safety. currently, these are the requirements, and this is what we're going to go through briefly here today. The requirement that employers have an injury and illness prevention program is not new. But the Cal OSHA does require a COVID supplement to that. COVID-19 emergency temporary standards are in place, and until they are altered are what we have to follow. There were some laws passed in number 3 and 4 relating to COVID-19 prevention in the workplace. And until the legislature repeals those, we're going to have to continue to follow those as well, regardless of what the governor does on June 15th. So this is just the general requirement in California. All employers must provide employees with a place of employment free from recognized hazards that are causing or likely to cause death or serious physical harm. COVID is one of those hazards. And so we do have an ongoing duty aside from any specific regulation or legislation to protect our employees from that known hazard. This is going to require, I would say, ongoing sanitation, availability of hand washing stations, this kind of prevention in your workplace. This is the link to the Department of Industrial Relations website, where you can gain additional information about putting together an injury and illness prevention plan. Every employer in California must have one. And there's a template here and some other information for you if you don't have one in place. I do assist my clients in putting these in place. So if you would like help, that's something we do offer here. So moving on from just that general requirement that you have an injury and illness prevention plan. The Cal OSHA emergency temporary standard was issued to address COVID-19 specifically. It's still in place. All employers are covered unless you only have one employee who doesn't have contact with other people. If you have employees who are working from home, they aren't covered by this standard because they aren't in your workplace. And employees covered by the aerosol transmissible disease regulations are not covered by these temporary standards. That applies primarily in healthcare environments. So on May 20th, Cal OSHA announced that it was not going to adopt its pending proposed revisions, and instead is targeting a new proposal with an effective date of June 15th to come in compliance with the governor's plan. This is what must be in a written COVID-19 prevention plan. The prevention plan is one of the primary requirements of the current emergency temporary standards. You have to communicate prevention procedures to employees and train them, identify, investigate, and correct any COVID-19 hazards. I think this is going to continue to be in place. If you have an outbreak or an exposure in your workplace, because COVID-19 is a workplace hazard at this point in time, Cal OSHA is going to require you to continue investigating and correcting any issues that exist. Physical distancing is one that might alter, although I'm thinking maybe masking will go first. Face coverings are currently required under the Cal OSHA temporary standards. Engineering controls are the plastic that we see hanging in workplaces, the spreading apart of desks and chairs. You have to currently provide testing to any employees who are exposed in your workplace. You have an obligation to exclude any employees who have been exposed or who have tested positive for COVID-19 or are experiencing symptoms. I don't think that's going to change. If Cal OSHA is not going to suddenly say that you get to let people with COVID-19 into the workplace. So some of these things are going to just remain with us indefinitely, I think. You have to establish return to work criteria for those employees who were exposed, and we'll talk about that a little more as well. The governor has modified that in regard to vaccinations. And then you have to maintain records and report to health authorities when required. So an outbreak currently is 3 or more cases in a 14-day period. Thankfully, we're seeing less and less of these. A major outbreak is 20 or more cases in a 30-day period. Employers have to offer testing to all employees exposed in the workplace at no cost to the employee and during their normal working hours. Employers have to notify a local health department within 48 hours of learning of 3 or more COVID-19 cases. So after learning of an outbreak, you have to maintain a record of all COVID-19 cases and notify employees in line with what became law after the last legislative session. We'll go through notification requirements in a moment. And you have to report any serious injury or death to Cal OSHA immediately. Cal OSHA currently is citing and issuing quite large citations in some cases as a result of injury or serious injury or death. So a lot of the Cal OSHA inspections and investigations and citations are being triggered by COVID-19 deaths or hospitalizations at this point in time. So this is the update I was just mentioning. So the emergency temporary standard has been revised as of May 7th to come into compliance with California Department of Public Health guidance for fully vaccinated people. So fully vaccinated individuals, and that means 2 weeks have passed since their last required vaccine. So for Moderna and Pfizer, that's after 2 weeks have passed after the second vaccine. For the Johnson & Johnson, it's 2 weeks after the Johnson & Johnson one-dose vaccine. So these individuals no longer need to be excluded from the workplace if they have been exposed to COVID-19 but are fully vaccinated. So this reduces the number of people that you have to take out of the workplace if there has been an exposure. So this is really helpful to a lot of employers and keeps a lot more employees in the workplace if they've been vaccinated. So as I mentioned, currently the emergency temporary standard requires a COVID-19 prevention plan. I think this is probably going to stay in place. Most employers have put these in place or at least issued some guidance that reflects these elements. I think on the next page, I have the website there where you can download a model prevention program and update it for your workplace as necessary. I write these also for employers who need assistance. It's important to address the different areas, and we're going to go through that. So if you operate a business that has a restaurant and a store and an office, you're going to need to address different things in each of those areas. But you have to have a system for communicating with the employees. I think that's common sense. It doesn't do much good to put in place a plan that you don't tell the employees about. You have to identify hazards and go through these required elements. And actually, I think this is a repeat slide. But anyway, this is what has to go into the plan, and you can find a sample here. So California last year, back in the summer, issued all of these checklists and then industry guidance with the recommendations. Actually, these were required to be implemented when a business reopened as we moved through the different tiers. Now, I haven't seen anything online or from the state about whether they are going to continue enforcing this guidance. But my inclination is that this is what Cal OSHA thought was going to make the workplace safe for these different industries. So a lot of these measures are still going to be applicable. So keeping social distancing is something that you could point to that you do in your workplace to prevent a hazard. And that's our general baseline, COVID, no COVID. We have to prevent hazards that could harm our employees. So some of these things are still going to be applicable. So I wouldn't say throw these out completely and don't look at them anymore. I think Cal OSHA is still going to point to these types of things as something that employers need to do while the pandemic is continuing to protect their employees from COVID. One of these do require masking, so that might be something that is modified. But still, I think in terms of modifications to the workplace, these are still important guidance documents. And when you're writing your COVID prevention program, you're going to want to look at the checklist and the industry guidance for the different areas of your business and incorporate those in, because that's what Cal OSHA has told us it's looking for, essentially, and the California Department of Public Health has signed off on. So some of these have been updated as the year went on. I think through like October timeframe, they were still being updated. I think there was updates to the real estate one more recently than that. So do check these out. They're still up on the covid19.ca.gov website, even though California has just been continually revising the guidance. It makes it very difficult to know what you're supposed to be doing. But I think taking that common sense approach that we need to keep our employees safe is going to remain necessary until the cases drop way down and it's not any different than a flu or other illnesses that we are used to being exposed to on a regular basis. This was the employer playbook on creating a safer environment for workers and customers. If you're looking for guidance on what you could do to increase safety in your workplace, this is still a good resource. It was issued at the end of September of last year. Cal OSHA, going back to Cal OSHA's requirements that are currently in place and I think are likely to remain in place, is recording requirements. If the log 300 is applicable to your workplace, those are high-risk workplaces, you have to record the COVID-19 illness if it resulted in the following: death, days away from work, restricted work or transferred to another job, medical treatment beyond first aid, loss of consciousness, or significant injury or illness, which would be diagnosis or treatment by a healthcare professional. It should be a confirmed COVID case to be recordable. And then aside from that log 300 requirement for our high-risk employers, we also have reporting requirements. And this is one of the things Cal OSHA is citing for. So if there is a serious illness, injury, or death that occurred at work or in connection with work, it has to be reported within 8 hours. So if you learn that your employee is hospitalized due to COVID-19 that was potentially contracted at work, or they became sick at work, even if they contracted it elsewhere, that needs to be reported. If it's not, and there's an investigation, it could lead to a citation. Also, if it's determined to be work-related, multiple cases in the workplace, contact with customers who have now reported that they were COVID positive, things like that would contribute to the finding that it's a work-related injury. If you have an employee working in a remote location, hasn't come into contact with other people, not as likely to be work-related. So you're going to do an investigation and try and figure this out if you are aware of a COVID-19 case by one of your employees. And you have a reporting duty even if it's not a confirmed COVID-19 case yet. Also, in California, we currently have, as part of the state law at this point, reporting requirements for workers' compensation. All positive COVID-19 results have to be reported, regardless of whether the employee contracted the virus from work or from home. It has to be reported in 3 days, and there's certain information that needs to be reported. Most carriers at this point have online websites where you can go and submit your report. You have to report to the Department of Public Health if you have an outbreak, 3 or more cases in 14 days, and that has to be reported within 48 hours to your local health department. Some health departments across the state, Los Angeles, some of the Bay Area counties, have different reporting criteria. So if you're operating in multiple counties, you might want to check that out. San Joaquin County at this point does not have COVID-19 regulations that diverge from the state guidance, and they are following the state guidance at this point. That may change, I think, if we have sporadic outbreaks as the overall state caseloads go down. So it's something to just watch and be aware of. You have to provide, under current state law, notice to employees of COVID-19 exposure. So this is the notice that has to be provided. And this is not going to be modified, I don't think, by the revised Cal OSHA standards, because this was passed by the legislature out of the last legislative session. So until amended, this will be the case. And I think common sense would dictate that through the remainder of the pandemic, there's probably going to be either this notice requirement or some other notice requirement in place because there's just still widespread cases. So written notice to all employees, subcontractors, and independent contractors who were at a work site during the infectious period who may have been exposed. The infectious period is still the same. It's 48 hours prior to either the onset of symptoms or a positive test with no symptoms. Written notice has to be also provided to employee representatives, including union representatives. You have to provide written notice that includes benefits the employees may receive, including workers' comp benefits, COVID leave, paid sick leave, and also a copy of the company's anti-discrimination, harassment, and anti-retaliation policies. And then you have to provide a notice of disinfection protocols and your safety plan to prevent further exposures. So we may see revisions to this, but I think there's going to be some obligation to notify employees of exposure in the workplace. And this is part of the COVID-19 plan for many employers. If you don't have these notices, or as this notice obligations change, it's something to follow. I also put together notice packets for our clients who are wanting to have them prepared and ready to go. Hopefully that will become less necessary as time moves on, but we're still seeing some outbreaks and exposures in some workplaces where social distancing is hard to maintain. This is kind of an outdated chart here. This is from March, but Cal OSHA is continuously publishing the citations that they're issuing for COVID-19. The initial penalty for violating the Cal OSHA temporary standard, which is the elements we just went through, it does incorporate all of those, is $13,000 to $25,000. Repeat offenses can be hundreds of thousands, up to 132,765. So here we see just some of the citations that were issued in March. You can see the first two are fatality initiated. The others are referrals from other agencies. And then that last one there is a complaint. So these are all they're not usually random. They're being triggered by illness, referrals, or complaints. Here's a copy of a citation. If you're interested, this is what they look at. This is a restaurant in San Lorenzo that received a serious violation. That's the level, and it relates to the amount of penalty for not having an injury and illness prevention plan in place, and for not including proper COVID procedures. Okay, that covers my workplace safety component for today's presentation, and what I think may change and what is currently required. Are there any questions at this point about workplace safety and Cal OSHA? My Q&A is over here. That's why I keep looking off to the side. No. Okay, great. Okay, so moving on to vaccines. So this is Fisher Phillips, which is a national law firm. They have COVID-19 materials that they've been putting out. They did a survey, and this is from their survey materials. The link to this survey is down there at the bottom. And I think it's very educational. So this question I get a lot is, can we mandate vaccines? Should we mandate vaccines? And what is everyone else doing? So this question asked, are you now mandating or considering mandating some portion of your workforce receive a vaccine as a condition of continued employment? 4% said yes, 83% said no, and 13% were not sure. So this is actually a down from January's survey, where more were considering mandating. So I think one way to look at mandating vaccines is not necessarily, do I think it's a good idea to mandate vaccines, but when someone refuses, am I ready to fire them? Because that's essentially what a mandate does. You either take the vaccine or you don't work here anymore. So I think when you look at it from that perspective, it helps to solidify for business owners really what approach they want to take. So that's why we see this 83% no here. And if you're not mandating, that's the next question, are you encouraging it? or considering encouraging employees to receive it. Here we see 75% yes, encouraging employees to receive. I think the changes to the mask mandates for unvaccinated employees that are potentially coming in California are going to change this as well, because many employees are going to want to not have to wear a mask anymore. On the next page here, I have, if you changed your policy toward mandating or encouraging, what factors have increased that? The main one is wanting to reduce outbreaks, which makes a lot of sense. And then the second one, 36%, is the CDC guidance permitting fully vaccinated individuals to be excluded from mask mandates. Now that's the CDC's guidance on that. California is not adopting that until June 2nd, according to what they've been saying right now. But that's what we're expecting to happen in California as well as of, I don't know what I just said, but as of June 15th. More people feel that the vaccine is safe. More people feel that their employees are receptive to receiving the vaccine. More employers see it as serving a greater good. So more employers are wanting to bring their employees back to the office and discontinue some form of remote work. So these are the different considerations that you may want to consider when making your own policy. For employers not requiring the vaccine, this is the largest, interestingly, is that the employer believes that everyone who is going to be willing to get a vaccine has already done so or is going to. A lot of employers are concerned that the law prohibits them from requiring vaccine. There is some legal liability associated with that. And so we're going to go through that in a moment. And then we have just concerns about the workforce not being receptive to vaccines. Basically, employers are concerned about mandating this and having to fire employees for not being vaccinated. So DFEH guidelines right now do allow DFEH, Department of Fair Employment and Housing, that's California's employment law enforcement agency. They do allow employers to receive the vaccination as long as there is no discrimination or harassment based on a protected characteristic. And in this context, that means someone with a disability that may prevent them from receiving a vaccine, perhaps an immunocompromised person where the doctor has not recommended it, and also individuals who have a sincerely held religious belief that doesn't allow them to receive the vaccine. We'll go through what that means in a moment. So this next question I think is interesting. I pulled these down off the DFEH FAQ, and the link is there on the bottom. If the employer requires an employee to be vaccinated and the employee rejects because they don't trust the vaccine, does that employee have to be accommodated? Do they have to be allowed to come back to work? And the DFEH says no. If the employee doesn't have a disability or a sincerely held religious reason for not being vaccinated, then you don't legally have to accommodate that fear. Can you require your employees to submit proof of vaccination if you're mandating it in your workplace? And the answer here from the DFEH is yes. And this comports with federal law as well, and guidance we've seen issued by the Equal Employment Opportunity Commission, the EEOC. Just asking for proof of vaccination does not solicit impermissible information about health or medical condition or disability. Where employers, I think, get into trouble is when they start asking why. Why haven't you received the vaccine? Which may potentially elicit information from the employee about their health condition, their ongoing cancer treatment, whatever it is. So that's where we want to be careful. But just requiring a proof of vaccination to see that vaccine card is something that the DFEH has specifically said is okay. And also you want to, I think I have this on future slides, be careful with medical information. The vaccine information is medical information. And going back to religious beliefs, they are pretty broad in California. So it doesn't need to be an express tenet of their religion, but it has to have some religious foundation. It's something other than a philosophy or a way of life. But on the other hand, it doesn't require connection to belief in a God or a supreme being, for example, Buddhism. And it has to address fundamental and ultimate questions having to do with deep and imponderable matters. These are all phrases that have come out of court cases, trying to address what is a religious belief and what is just a lifestyle choice. Essentially, a religious belief is a comprehensive belief that is a belief system rather than just an isolated teaching. For example, a court has said that veganism, specifically outside of some kind of religious belief that prevents eating meat, is an isolated teaching or a philosophy or a way of life rather than being a religious belief. So most of you aren't going to encounter this, I don't think, with your employees, but I just thought it was interesting because that is one of the exceptions. Disability is the other exception, a mental or physical impairment, disorder, or condition that limits a major life activity. It can include a diagnosis of HIV and AIDS or other medical conditions or health impairment related to cancer. It includes individuals who are considered to be disabled. So sometimes this comes up when an individual had a health condition in the past and an employer is assuming they aren't going to get the vaccine without having actual information to that effect. And a COVID-19 diagnosis and COVID-19 symptoms in a lot of patients do rise to the level of being a disability because of ongoing health conditions that are created by the COVID-19 virus that then impair a major life activity. Breathing, walking, working, those kind of things. So one thing to look out for is if you have an employee who had COVID-19 in the past, a severe case of it, they might now have a disability. One of the things we look at when deciding whether we can exclude people from the workplace, so you say everyone must be vaccinated, and the employees don't want to be vaccinated, do we fire them? One of the things we look at in other cases outside of the COVID-19 context is whether that employee poses a direct threat. We know that COVID-19 is a direct threat in certain circumstances. In medical contexts, for example, I think that's more straightforward. In a workplace where everyone is able to be socially distanced, you look at a different set of criteria, I think. What's the duration of the risk? What's the nature and severity of the harm? What's the likelihood that the harm will occur? What's the imminence of the harm? And can it be eliminated through an accommodation? So someone who is disabled and cannot receive the vaccine, do they pose a direct threat to the workplace? Can they be accommodated? This all needs to be individually assessed when you're deciding how far am I going to take this mandate in my workplace. If you're going to terminate an employee for not receiving the vaccine, that probably is a situation in which you would want to consult your employment counsel, because I think those are going to be some of the lawsuits we're seeing. Right now, I think lawsuits are focusing more on failure to accommodate COVID-19 related symptoms and failure to provide adequate leave or legally required leave. We're going to go through leaves in a moment. But those are the, I think, hot button issues for COVID-19 lawsuits right now. So my recommendations with regard to vaccines are be careful with disability related inquiries. You may need to know if someone has received the vaccine so that you can determine whether they have to wear a mask if our guidance changes. But you don't need to ask why necessarily if you're not mandating that. You would need to know if the person had a disability or a religious belief that would give rise to a need for an accommodation. But outside of a mandate, you probably don't need to know why employees are not receiving the vaccine. Maintain all vaccine records separately from the employee file. They're treated as medical records, and we keep employee medical records in a separate file. And then beware of time off requirements for receiving vaccines and for vaccine related symptoms. So we'll go through those in the time off section more, but if you're mandating vaccines or encouraging them, you're going to have employees with vaccine related symptoms and time off. Also, if you mandate vaccines, the vaccine-related side effects likely become a workers' comp-related issue. If you're going to just voluntarily incentivize vaccines, we do have to be aware that the Americans with Disabilities Act has wellness program rules. And wellness programs are programs that often give rise to discounts through insurance companies. And it could be a smoking cessation program in a workplace. Larger employers tend to have these. But the higher the incentive, the higher the risk associated with that, because there is concern that employees with disabilities may not be able to receive the benefits. So if you're offering some kind of a benefit and an employee is disabled and can't receive the vaccine, they need to be able to earn that incentive through some other alternative. So maybe they could watch a safety video. Maybe they could do something else to receive that incentive that's being offered to those who are actually being vaccinated. Some low risk incentive options that a lot of employers are taking are education. At the outset, I think there was a lot of vaccine hesitancy. As more and more people are being vaccinated and it's more commonplace, we're seeing vaccine hesitancy going down. Provide information to your employees on where they can obtain vaccines and the eligibility criteria, which has really dropped off now, 16 and above, I think. Offer transportation for employees in certain groups that do not have access. Offer vaccines at the workplace. The next slide will go through that a little bit more. Offer time off to get vaccines, either paid or unpaid. And actually now, if you have more than 25 employees, you're covered by the COVID sick leave for time off to get vaccines. And then offer de minimis vaccine incentives, water bottles, company swag, whatever it is. So recently, California came out with this employer vaccination toolkit, and the goal is to get vaccines into more people. So if you are interested in offering a vaccine clinic at your workplace, or figuring out if there can be one offered in an area close to your workplace, this is a good place to start. I've got the link down there at the bottom, but you could host a worksite mobile clinic. You could have, this puts you in touch with vaccine providers through the state. So that is something to look into if you're interested in offering vaccines on your site or nearby. It also provides just information that you could distribute to employees as well. Okay, so that's my section on vaccines and whether you can require them and how to incentivize them and some of the concerns. I'm going to look at the Q&A because I see there are some questions. Okay, so I have a question. What's the best way to determine which employees are not vaccinated? You can ask them. That's a permissible question. You can ask to see their vaccine card, also permissible, but keep it separate from their employee file. HIPAA does permit that under state and federal law, but you're going to want to restrict the number of people that have access to that information. So that's a need to know type of question and documentation. So maybe HR only needs to know that. Maybe the supervisor only needs to know that. If mask guidance changes and unvaccinated people have to continue wearing masks, you might need to be giving out a list of those who have been vaccinated. And that's also maybe relevant to work assignments as well. If vaccinated employees are going to have more contact with the public, for example, or are going to come back into the workplace while unvaccinated people are going to work from home, whatever it is you're going to do. Okay, those who have chosen to vaccinate do not need to wear masks. That's not currently the rule. California is still requiring masks in workplaces, all workplaces. So we have not yet adopted the federal CDC guidance. So I anticipate from what we've heard that Cal OSHA and the state are going to change mask guidance, but it hasn't happened yet. And it's not clear yet. So you're going to want to stay on top of those guidelines. I lost my train of thought. But yeah, currently masks are still required. Can employees who have antibodies object to an unnecessary vaccine? At this point, I don't think that I've seen any guidance differentiating between employees who have had the virus and who have received the vaccine. This may be a reason that they can't be vaccinated. For example, I know there are some physicians with severe cases of COVID-19 recommending that people wait a certain amount of time after recovery to receive the vaccine. But I haven't seen coming out of the CDC or the State Department of Public Health any distinction between those who tested positive before and those who didn't. So we'll have to wait and see. I think the science is still evolving on that. And I do know that previous reports indicated that the immunity from having the illness does not necessarily last outside of 3 months, whereas the vaccine, I think they're saying does. I'm not a scientist, but so far I haven't seen any guidance to that effect. Okay. Oh, more questions. May women who wish to become pregnant object without a religious reason? They would need to have a legitimate medical excuse relating to a health condition. Pregnancy in California isn't technically a disability, but I think this is really where we get into the concerns. Oops, jumping ahead. Well, this is really where we get into the concerns with, do you want to mandate it? Are you prepared to terminate a pregnant employee? Does she actually pose a direct threat to the workplace? That's, I think, definitely difficult. So you can tailor your requirements to your workforce, but that's where I think you run into more liability. If a pregnant woman is going to refuse a vaccine, or someone trying to become pregnant is going to refuse a vaccine, are you prepared to terminate them? So I think that's the question you have to grapple with as you decide the scope of your policies and how many accommodations you're going to offer. You can offer more accommodation than the law requires. And it's hard to find employees right now. So maybe you don't want to lose a good employee for that reason and can offer some accommodation that goes above what the law requires of you. Okay, moving on to, oh, I had a follow-up question on that one. Doctor's advice. If they have a doctor's note, it doesn't rise to the level of disability necessarily, but I think you're really getting into an area of high liability. So I think you're going to want to look at that particular employee, their particular condition, why the doctor is recommending against the vaccine. Most pregnant employees I've encountered to date, which is just anecdotal evidence, have gotten the vaccine. So I think it really depends. Okay, so California has supplemental COVID paid sick leave in place right now for employers with more than 25 employees. It's effective retroactively to January 1st. Don't you love California? It's so confusing when they make things retroactive, but this is retroactive to January 1st and is in effect to September 30th at this point in time. It provides up to 80 hours of COVID-related sick leave and a pro rata allocation for part-time employees. Pay is $511 per day, up to $5,110 for the 2 weeks. It has to be separately listed on the pay stub. Retaliation and discrimination are prohibited. And there was a grace period in place until March 29th when it technically went into effect. If this applies to you, there is a notice. The link is there. It's on the Department of Industrial Relations website. So you have to put that up in your workplace or otherwise distribute it to your remote workers. And they have issued a frequently asked question on it, which is very helpful. So I recommend you take a look at that if you have any questions. The supplemental paid sick leave applies to employees unable to work or telework due to their own condition, because they've been subject to quarantine or isolation or experiencing symptoms and seeking a COVID diagnosis, and also to care for a family member who is subject to quarantine or isolation, and to care for a child whose school or childcare is closed due to COVID-19. So thus far, this school or childcare closure at the federal level was intended, and I think at the state level, intended to apply to schools that were physically closed to students on campus. So that would cover distance learning. The federal law specifically does not apply to schools that reopen and the parent elects voluntarily to keep them home. Now, this may be due to a child's healthcare condition or something else that you might want to look into, but there was that distinction drawn with the federal program that allowed for reimbursement. So that is something to keep in mind. If you have questions about someone whose child is not attending school currently, go ahead and message me about that specific situation. I think someone submitted a question to me in advance of the webinar, and I'll go ahead and answer that for you. Also, we're going into summer break. So this is not going to apply over the summer. For a period of time when students were ordinarily scheduled to be out of school, there is no COVID leave for that. Now, if their childcare is closed due to COVID, or if their normal summer care is canceled due to COVID, that's something different. But just the fact that school is on summer break is not does not qualify for the COVID leave. Also, we cover vaccines under this law. So attending a vaccine appointment or experiencing vaccine-related symptoms gives rise to the right to use the COVID sick leave. The rate of pay is the regular rate of pay for the work week in which the leave is taken. Be careful if you offer bonuses or other non-hourly compensation that you're correctly calculating the regular rate of pay. It might not be the employee's hourly rate. It has to meet the state and local minimum wage. This would apply more for employees on a commission basis, for example. And the alternative is to average hourly pay for the preceding 90 days, and that allows you to exclude overtime. Exempt employees are paid the same rate of pay as wages for their other paid leave time. This was the retroactivity provision here. I'm running out of time. You have to pay by the next payday if an employee requests retroactive COVID leave for time that they were previously off. And you have to provide an accurate wage statement for the retro pay. The federal law, I'm just going to go through quickly. I've covered it in a lot of past webinars, and they're up on my website. This was expanded April 1st through September 30th of this year. It's optional. Employers do not need to provide this leave, but they can elect to do so. So if you have more than 25 employees and you're required under California law to provide COVID paid sick leave, you might want to consider voluntarily offering the federal leave because it comes with a tax credit. And the amount of payroll taxes that you pay is reduced by the amount you pay for federal COVID leave. Employee leave banks were refreshed on April 1st to include 80 additional hours. The family medical leave portion of this was not refreshed. So employees can continue to use what was part of their original allotment. So they originally got 12 weeks of protected leave at 2/3 pay. That continues, but if they've used up their 12 weeks, they didn't get a new 12 weeks on April 1st. There are some new reasons for leave that are now covered, including the vaccine or recovering from vaccine side effects, and awaiting results of COVID-19 test when the employer has taken the employee out of work, which was very common and is required in California under the temporary Cal-OSHA standard. So there's more reasons that you can use the federal COVID leave and get the tax reimbursement now. And this is through September 30th. There are now quite a few local COVID sick leave provisions for different cities. So I've got a list here of the major ones. There may have been some new ones added, but I don't think so. I think this list is pretty complete. But if you have employees operating and working in cities other than our local area here, you're going to want to check this and make sure that you're complying with these sick leave provisions, which do differ from the state requirements and sometimes provide additional requirements. Okay, I reached the end and I have 5 minutes left for any additional questions that you might have about anything we covered today. Go ahead and put it in the Q&A or the chat at this point, and I will answer your questions. If you have any follow-up questions, please feel free to email me. I can't answer questions about specific employee issues without actually being your lawyer, but I'm happy to answer general questions about the information provided. If you would like a copy of the slides, please send me an email. My email is there on the screen. If you put it in the chat, that's going to disappear when I close this webinar. So please email me and I will send you a copy of today's slides. Also, I am going to post this webinar on Kroloff's website. And there's a video page where you can watch this webinar and our other webinars, including from our state planning team and myself. I have a series of short videos up on various employment law topics, which may be of interest to employers. And then past COVID webinars as well, although this information becomes outdated so fast. For June 15th, I'll probably end up doing another one of these once we get the new Cal OSHA regulations. Okay, if you do not have any questions, I'm not seeing any additional questions at this time, so I'm going to go ahead and wrap this up. Thank you all for attending, and continued good luck for keeping up to date on all of the current California regulations, and hopefully all of you and your employees stay safe as we move forward. Thank you so much.